Antibiotics. In this video, we will mainly cover the penicillins and cephalosporins. There are 7 different kinds of antibiotics are being used right now. Penicillin, cephalosporin, tetracycline, macrolides, aminoglycosides, fluoroquinolone, and sulfonamides. In this one, we're gonna focus on penicillin and cephalosporins because they're really closely related classes to each other, so it'll be much easier to learn them together. Okay. So, mechanism of action of penicillin. So, this is bacteria, and in the bacteria, they have a penicillin binding protein receptors on their surfaces. Right there, all of them. Now, the penicillin, what it does, it binds to the bacteria by the penicillin binding proteins, and it weakens the cell wall. When it weakens the cell wall, all the water goes into the bacteria and destroy the bacteria, basically destroy the DNA, RNA, and all sort of things. That's why that's the mechanism of action of penicillin killing bacteria. Now you may have some questions. Okay, why doesn't kill the human cell? Bacteria cell, it can kill the human cell as well. However, the only reason it doesn't do in a human cell did not have a cell wall. Bacteria has the cell wall. Human do not have a cell wall. Human do not have cell. Human cells do not have a cell wall. That's the reason. That's how the penicillin will kill the bacteria cell, but it will not kill the human cells. Now, bacteria are a little bit smarter as well. So what they will do, because when bacteria also recognize, okay, this penicillin is weakening my cell wall. So what they will do, they will produce this beta-lactamase, or also known as penicillinase enzyme. And what that enzyme will do, it will breaks the beta-lactam ring in the penicillin, which is this ring in the penicillin, and that's the important ring in order to kill the bacteria. But now bacteria produces this enzyme, it will kill this ring, then the penicillin will be ineffective. That's why when we call this bacteria are penicillin resistance, they are not gonna get killed by penicillin. That's how they develop resistance. And also, like, if you use this penicillin over and over and over, and that's how this bacteria gets a resistance to penicillin. That's why we prefer to change antibiotic very often, so they did not get resistance to any antibiotic. Now, in order to increase the effectiveness of penicillin in this case, they add to some agents. Like, if you see, I have 2 examples: piperacillin tazobactam and amoxicillin clavinulate. Now, this second part, these agents, what they will do, they will destroy this enzyme. So when they destroy this enzyme, automatically bacteria won't be able to kill this penicillin. And when the bacteria won't be able to kill penicillin, the effectiveness of penicillin antibiotic will increase, so it will require lower dose as well. So that's why you may see often with the penicillin antibiotic, like piperacillin tazobactam. Now you may be wondering what the tazobactam is. Now the tazobactam is really important in order to increase the effectiveness of penicillin, since it kills the beta-lactamase enzyme. Alright, let's go. Now, penicillin are used for gram-positive bacteria, streptococci, and staphylococci. This is not really important to remember, just for information, why they're used and for which kind of bacteria they're used. Now they're divided there in 3 different categories. The penicillinase resistance penicillins. So these penicillins are not affected by the enzyme produced by the bacteria, which destroys the penicillin. So these are naphthalene, oxacillin, dicloxacillin, cloxacillin. So this penicillin do not require any kind of like tazobactam or anything in order to prevent their breakdown. The broad spectrum includes the amoxicillin, clevinate. It's kind of hard to pronounce, but that's the one in order to prevent the breakdown of amoxicillin by the enzyme that bacteria produces. Ampicillin and becampicyllin. Extended spectrum includes the piperacillin, carbanicillin, and ticarcillin. So, I mean, these are really easy to recognize medication. All have a cillin at the end of their name, but they're divided in this kind of categories. Side effects. The side effects is basically the allergy from the penicillin, fever, rash, pruritus. And the main side effects to remember for penicillin, that decreases the RBC, WBC, and platelets. So they basically decrease all blood cells. That's the main one to remember. And often tested in the NCLEX as well. Now, the next drugs we're going to talk about, the class is cephalosporin. They are really closely related in the structure and mechanism of action, side effects to the penicillins. Even like I think about their cross sensitivity to the cephalosporin and penicillin as well. So if a patient is allergic to penicillin, there are high chances they'll be allergic to cephalosporin. Now it's vice versa as well. Like if they are allergic to cephalosporin, there are high chances they're gonna be allergic to penicillins as well. So that's the things to remember. Like if you have a patient and they have a penicillin allergy listed as a penicillin, and the physician may accidentally prescribe the cephalosporin, so you want to question that order and ask physician, do you really want to give the patient cephalosporin even though they're allergic to penicillin? Okay, and these are the examples of cephalosporin. First generations were the first one, like really old cephalosporin. For example, cefazolin, cephalexin. Those are the most often used cephalosporins. They're effective against streptococci and staphylococci. Yes, I meant that second generation right there. So this is not first generation. It's second generation cephalosporin. It includes the cefaclor, cefprozil. These are rarely used drugs right now, first and second generation. They're really potent than first generation, but the resistance to beta-lactamase and effective against the gram-negative. Now this is the one they're often used, is the third generation and the fourth generation. And if you're working in the neuro ICU, which I used to work on neuro ICU, you'll see these drugs often used, because these third and fourth generation can cross the CSF and can go into the brain and treat the infection. So that's the ones important to remember, the third generation, and they're actually broader spectrum and longer duration than first and second generation as well, and they're resistance to beta-lactamase as well. So they do not get resistance to those bacteria really easily. And this is a fourth generation. I have seen this one used very, very often in a neuro ICU because they have even less side effects compared to the third generation as well, and can enter the CSF. So these are all the examples of cephalosporin. There are a lot, but easy way to remember, they all have a CEF pretty much in the beginning. So these cephalosporin examples. Side effects is kind of same as the penicillin, like allergy, fever, rash, pruritus. Instead of decreasing on all the blood cells like as the penicillin does, this medication do not do those decrease in blood cells, but they can have GI problems, like a stomach pain and like a diarrhea and those kind of stuff, those kind of complaints. And this medication can cause kidney toxicity, so you really want to monitor the kidney functions when if a patient's on this antibiotic. You want to monitor creatinine and BUN in order to make sure the kidney functions are good. And you do not want to give any patient this medication if their kidney functions are impaired as well. So those are the side effects and contraindication. Those were the information about the penicillin and cephalosporins. If you have any questions, you can ask us and email us. Thanks for watching.